This is a CBC podcast.
I'm Ramona Deering in St. John's, and this is the Crosstalk phone-in. Today, a show that we planned to bring you a week ago, and I know that there's interest because lots of people got in touch to ask why it didn't go ahead. Today is your chance to ask cardiologist Sean Connors about heart health. He was actually called away to surgery last week, so that's pretty cool. He's here now along with John Kirby with Heart and Stroke NL. The numbers to call in 722-7111 or 1-800-563-8255. That's your questions about heart health. This information is going to help all of us. Looking forward to your calls. So let me first welcome John Kirby, the Manager of Health Promotion for Heart and Stroke in Newfoundland and Labrador. Great to have you here.
Excellent. Thanks for having me.
And I know that one of the things you would like to speak about in the time ahead on the program, John, is actually young people and heart health, which is, kind of hard to believe because we think young people are so healthy, and hopefully most of them are here in Newfoundland and Labrador. But we have to talk about it, don't we?
We do. And it's at any age, really. We need to understand that it's not just older adults. It is young, right through people 30, 40.
And I would like to welcome cardiologist Sean Connors onto the program. Great to have you here. We thought that was so cool that you couldn't join us last week because you were saving somebody's life in surgery. So,
well, I don't know about that, Ramona. It's a pleasure to be here for sure. And I felt so disappointed about not being able to make your show last week. So it's nice to have the invitation to come back so soon.
We kind of feel that, the health of a human being is probably a little more important than this little old show. And again, we found that so dramatic and cool. So you really gave us some excitement on Crosstalk last Wednesday. Some really valuable perspective there about what really matters. Just before we continue on here, I want to thank listener Herb Pack, who sent in the idea for today's Crosstalk phone-in. I've been telling people that we do consider all ideas for future shows, and we welcome them all. So if you would like to suggest something that you'd like to hear on the show, you can send us an email, crosstalk@cbc.ca. That's crosstalk@cbc.ca. And thanks again to her pack for today's show. So, Dr. Connors, probably one thing we should talk about straight off the bat. You can't diagnose people live over the airwaves, right?
No, that's true. Look, I love seeing my patients in clinic, but, to really find out what's going on with their heart, I need to see them in front of me. A heart rate, a blood pressure, a look at their face, a cardiogram. And so if anybody phones in today with concerns, we can talk about, generally their condition. But, geez, it'd be difficult to give them a diagnosis without all the information on hand. I don't think they'd want me to.
Yeah. So if people are wondering about tweaking medications, et cetera, this is not the place for that. But there's so much that we can talk about with heart health. I know that, for instance, the symptoms of heart attacks can be radically different for men than for women. And we've actually heard from women in the past who did not go to seek treatment, not realizing that they were having a heart attack. Or actually, I think we've heard from both men and women and transgender people on this show that they had symptoms, but they didn't go to get help because they didn't want to they weren't sure what was going on, and they were embarrassed, and they didn't want to cause any problems, right? They didn't want to gum up the system. But in fact, they'd actually had heart attacks. How common is that, Dr.
Ramona,
Connors?
that's very common. And if there's one thing that people that listen to the show might be able to take away, and that is that if they're concerned, like your own body, and if something doesn't feel right, like that's why we're there. Like they should come in, they should have the conversation. The people in the emergency room are professionals, the nurses, the physicians, and we are prepared for. Not everybody shows up with the classic symptoms of an elephant sitting on their chest, crushing pain, sweating, so on, what the movies show you. I mean, sometimes women don't present, for example, like that. 50% of the time they'll be with symptoms of a heart attack, and they don't get diagnosed as having a heart attack. But the news is not all bad. I think that if you look at the way we can diagnose heart attacks, our technology has improved dramatically over the last 2 decades. So I would encourage people, if you're having symptoms that you're worried about, show up. I'm going to tell you a quick sad story a few years ago from one of my patients, typical man in his 40s. He's from central Newfoundland, Gander, I believe. and had, driven to the hospital with crushing chest pain, got there on his own, driving, drove around the parking lot, decided he wasn't going to go in and bother those people in the emergency room, drove back home. Now, luckily he did well, but the heart attack was much bigger than it needed to be. He didn't come in because he was tough. He was somebody that never had anything wrong with his health, and he was going to handle this on his own. I don't want that to happen.
Right. But that leads me to a couple of follow-up questions. First of all, how can women's symptoms be different than men's when we talk about heart attacks?
Well, why they're different, I'm not sure if I have that answer. But we know that they are different. I mean, women are different than men. They're much more complicated maybe in many ways. I don't know about that. But when it comes to the heart, we do know that they're wired a little bit differently. So more typically, they don't have that central chest crushing pain. They can have pain in their elbow, pain in their back. They can have maybe a sore head or pain in their jaw. So these atypical variants, not the classic description you read about in a book, are more often what women present with. So when they come in with those symptoms, it takes, if we look back at what has been published in terms of statistics in North America, it takes us a little longer to make their diagnosis, a little longer to do their cardiogram, maybe a little longer to do their blood work, before we realize that, women are presenting, and they're not the typical presentation of heart attack that we've all kind of been trained to look for.
Well, wasn't all of that based on looking at heart attack symptoms in men? Weren't women traditionally left out of the picture?
Ramona, and that's the other thing. If you look back, it's been kind of very male-centric over the last few decades. All the studies that have been done that got us where we are now in terms of how to treat heart attacks, 75% of people in those studies were male, right? They aren't women. And so some of the nuances, some of the subtleties in which women can present differently or have different types of heart attacks kind of have only come to light more recently. But the news is not all bad. If you look at the outcomes, how often do women survive heart attacks over the last 20 years? It's been improving steadily over time. So although their outcomes are not quite the same as men's now, for a number of reasons, the fact that they're much better, I think we can't lose that as we look back over where we've come from 20 years ago.
Yeah, just some anecdotal thoughts here. I really don't hear women sitting around going, gee, I wonder if I'll ever get heart disease. But I strongly get the sense that men sometimes talk to each other about this and kind of say, I got this checked out. Have you gotten it checked out? It seems to be perhaps more on men's minds. Like I say, that's just anecdotal there. All right, so here's my follow-up question for you, Dr. Connors. How do you know if you're just having heartburn versus a heart attack? Because I think a lot of people think, oh, I feel like, heartburn is very painful and unpleasant. And you might think initially, oh, what's going on here? This is weird. And then you go, oh, it's nothing. It's just heartburn, a little acid reflux.
Yeah. Ramona, I was asked that question twice this morning in my clinic. And I can tell you that I've been 20 years back here in Newfoundland, totally immersed in heart disease. And I still I could not give you a straightforward answer to that question. That I think if you're worried about a pain that's occurred recently, that's not typical for you, then you should have it checked out. It is not 100% that we can distinguish just talking to you one versus the other. We may need to do some tests because they can overlap those types of symptoms. And as I tell my patients, if we think heart disease might be playing a role, we have to rule that out. Heartburn can kill you. If we miss heart disease, that can. So the stakes are high. So unfortunately, we've got a kind of a common, largely benign condition that overlaps with some similar symptoms to a heart attack. So what are the things that worry me? Well, new onset of symptoms. They happen when you walk. I mean, you shouldn't get heartburn if you're walking upstairs, right? If the symptoms occur with food, spicy food, acid reflux in your throat, those sorts of things, well, yes, it may be more benign, but it's not always straightforward. So you know your body best, everybody who's kind of listening to the show. If this seems funny or it makes you feel really unwell, see your family doctor, come into the emergency room. It's worth getting that checked out.
And you'll be seen quickly on the upside. A little joke, little black humor here on the Crosstalk phone in. So I'm in studio with cardiologist Sean Connors, and we are taking people's questions about heart health. So don't be shy. Any questions you might have on this subject, you can pick his brain and also the brain of John Kirby, who is here from Heart and Stroke in Newfoundland and Labrador. The phone numbers for you again, 722-7111 or 1-800-563-8255. That's 722-7111 in the St. John's area, or toll free at 1-800-563-8255. John, I saw a release that Heart and Stroke put out, and it kind of surprised me. It is flu shot season now, and an awful lot of people are getting flu shots. But Heart and Stroke is strongly encouraging people who have any history of heart disease to get the jab, right? Get the flu shot.
Absolutely.
Why is that?
Well, the biggest thing we find is that people with even risk factors of heart disease or stroke need to get the flu shot. It's not only going to protect you, but it's going to protect your family members, your loved ones, and to really understand that it's the best thing to do, especially this time of season.
So getting the flu can be bad for your heart? Is that the case? This is Dr. Connors.
Yes, Ramona, it is. So first of all, the flu can range from, a few sniffles to something that leaves you in an ICU on a breathing machine. So the flu can affect your heart in several ways. First is, it's just a general stress to your body. I mean, if you get sick, of course, your adrenaline levels go up, your heart rate goes up, your blood pressure can go up. So it stresses your underlying system and your heart. And secondly, the flu virus can actually directly affect your heart. We sometimes see that the virus causes an inflammation in the heart, can make your heart weak, it can cause your heart to beat funny. So we'd prefer...
And we're talking about actual influenza here.
Exactly. Not the common cold. No, actual influenza, which is what the flu shot will largely prevent if you get it appropriately, and that is the type of flu that's going around this season. It's never 100%, of course, because the flu has many variants, and we always hope that the vaccine covers the common one this particular flu season.
Yeah, fingers crossed on that one, because lots of people are in the process of getting their shots
Ramona,
now.
I'd like to say that I did get my flu shot yesterday. The excellent nurses that deliver our vaccine at the Health Sciences showed up at the cardiac OR, and it was nice to see that everybody lined up. I think that I've seen great engagement among healthcare workers to get the flu shot, and it's really built in this year even more than previous years.
And do you mind if I ask how you're reacting to it? I hardly even felt they're professional. I didn't even feel the needle go in. I got a chance to win an iPad. I got a little sticker, no lollipop, and I have no consequence the next day. So you don't have any swelling or soreness
Not
today?
At all.
You didn't feel fatigued a few hours after?
No, I know some people may get those symptoms, but I wouldn't have known that I had it.
Yeah, excellent. Yeah, good to hear. All right, so Herb Pack, who is the Crosstalk listener who suggested today's phone in, and it was an excellent suggestion, obviously. One of the questions that he had for you, Dr. Connors, is cannabis. It's been legalized in this country for 1 year now. What do we know about cannabis and heart health? Is it good for your heart? Is it bad for your heart? Do we know anything?
Okay, Ramona, well, I think that's a great starting point. First of all, we don't have the studies to be confident one way or the other. I mean, a marijuana cigarette has more than 70 chemicals in it. And we worry as healthcare professionals in the cardiac space that we don't understand the interaction of those chemicals on plaque, on buildup, on heart disease. I think my belief, and I think that's shared by many other people, is that if you're smoking anything, it's not good for your heart and lungs. It could be cardboard that you smoke. So I think smoking, there are some unanswered questions, potentially some risks. I think smoking of any kind is not good for your heart, and it should be minimized. Cannabis and edibles, again, we don't have the studies to be confident about that. And although we think that some of the active component of cannabis in these edibles that are about to be launched on us are quite safe. There was a case report that I found very intriguing that came out of New Brunswick, in which elderly man, he had taken a lollipop which had 70 milligrams of THC, the active component in cannabis. And the
that
reaction
sounds like an awful lot.
I know.
I'm not an expert on the numbers, but that sounds
20
extremely
is supposed
high.
to be kind of the acceptable upper limit. So that's the one thing about edibles. Sometimes it takes a while to affect you. So by the time you realize you're being affected, you've ingested a lot. And that induces a response where your heart rate can go up, your blood pressure can go up, you feel anxious, you may feel delusional. And that in of itself caused him to have a heart attack because of the stress it put on the system. So it may not be a direct toxic effect, but we have to be careful that we don't understand the full repercussions of some of these on your cardiovascular health. Maybe if you're young and healthy, that poses a very small risk. But if you're somebody with heart disease, you've had a previous heart attack, bypass surgery, I would strike that note of caution. We do not have the scientific studies to support their complete safe use.
Okay, so that would apply to vaping as well, I
Correct.
guess, which is
Correct.
very much the safety of vaping is clearly an issue in the United States where so many people have become seriously ill. There have been some deaths, and it's still a mystery as to what's causing it. And what about like many of our, just before I go on to a caller here, many of our listeners are using CBD oil, so that's another ingredient. It's I guess it's debatable as to whether it's psychoactive or not, but it doesn't tend to alter your consciousness in any way. But a lot of our listeners swearing by it for things like arthritis, going through chemotherapy and helping with that nausea, helping people sleep, et cetera, et cetera. A lot of people feeling that they're getting great benefits from ingesting CBD oil. Right, so they might be taking tablets or just squirting a little bit of oil into their mouth. Do we know anything about that and heart health?
I think the risk is probably less, Ramona, when it comes to that. And I get asked this question very frequently by my patients. And I think the risk is low. I do advise them try it. I mean, I think response is individual. If they find that it helps them, particularly in terms of arthritis, for example. We use medications for heart disease in which we don't like to combine the anti-inflammatories because it might increase your bleeding risk and so on. So sometimes people find this a very satisfactory alternative. Do I have the scientific evidence to say that it is 100% safe? No, but I think the risk is probably less than the more psychoactive components with THC and so on.
Okay, so hopefully there will be a lot more information for everyone, not just patients in the years ahead, because I don't think this information is coming out in the next few months, but I'm assuming that there are various medical studies underway. All right, so let me give out those phone numbers again before I go to the phone lines here. We've got John Kirby, who is with Heart and Stroke in Newfoundland and Labrador in studio, and cardiologist Sean Connors. So it's your opportunities to ask questions about heart health. Those numbers again, 722-7111 or 1-800-563-8255. All right, we have Renita on the line from Placentia. Hi, Renita.
Hi, how are you?
Great. Thanks so much for calling in.
Yeah, it's actually out of my grandmother's suggestion.
Oh, great, because Nans always know best.
She's super Nan.
Awesome. So do you have a question for either one of my guests today about heart health?
Cardiologist, actually. Or both, whoever
Sure.
wants to help.
Go ahead.
Can I go ahead?
Yes, go ahead, Renita. They're listening.
Okay. Well, back in September of last year, I was in a major accident that I caused, and I was diagnosed thereafter with tachycardia, high heart rate. And there's not much information I was given about it, and just curious. I'm only 33 years old. I'm a mom and a wife, and just wanting to know how to live my life normal so that, I don't have to worry about high heart rate.
Okay, so that's a great question.
Right. I see a lot of patients with similar complaints. And I think, first of all, what does high heart rate mean? So I generally would advise people that your normal heart rate is between 60 and 100 beats a minute. And what determines where exactly you sit in that range? It could be the type of medications you're on, your physical fitness. Generally, as you become more conditioned, you drift towards the bottom of that range, and you might find athletes are even sitting around 50 or 45 beats per minute. Oh. Entirely safe, entirely normal. Yeah. And, if you, before your accident, were much more active, and now since your accident, you find that your level of activity is less, it's not unusual
I've been more active since the accident.
Oh, okay.
Yeah, way more active.
So I would generally encourage someone like yourself to, there's a simple test, doesn't hurt at all, a cardiogram, and we could tell whether your heartbeat when it's faster is normal or not normal.
Is that the holster that they give you?
Yeah, well, there's two. A simple cardiogram takes a minute or two, and then the thing that you leave that stays on your body for 24 or 48 hours. Yeah,
it stays on your body 24 hours.
Okay. And that would be a great test for us to determine two things. One, is your heart rate beat the kind of normal heartbeat?
Yeah.
Or have you changed gears into something else? And two, even though you might feel it is faster, is it actually faster? Like, I would like to know, what does it do when you're asleep at night? Does it drift down? Because most people who have a normal elevated heart rate, it'll drift down when they're asleep.
Right.
I would try to avoid medications for a normal heartbeat. And
I am on a medication now.
Okay, yeah. But so it would be difficult to tell you what you need to do or what to expect in the future unless we kind of knew the results of your tests.
Yeah. Well, when I had it last year, they said at a few points in the holster it was like 150, and my normal one was like 72.
Right, but I mean, not unusual for a young, healthy person like yourself. We would generally tell people that your maximum heartbeat could be, 220 minus your age. So going to 130, if you were sprinting for the bus or climbing stairs quickly, wouldn't worry me at all.
No, okay. Well, I guess that's good. But, I am on a medication now, and I do find my heart rate has lowered. And it's given me a lot more energy, that's for sure.
And John, Heart and Stroke has a couple of Facebook groups for people. Can you tell us about them? And I'm wondering if that might be a resource for Renita.
Yeah, absolutely.
In terms of having like some other people who've gone through similar experiences who can share their information as well.
Yeah, we have two Facebook groups, one for what we call people with lived experience or survivors, and one for caregivers, so people who are affected by heart disease or stroke in any way. They are joinable Facebook groups. You can search them as the Facebook group on your page, and you can request to join, and they will approve you as is. We have about 4,000 people across the country right now, and there's lots of support. There's videos. There's especially we like the group discussions that go on, and it's not only the moderators that step in, but it's the community from anywhere from the Yukon right down to the Toronto areas that people are willing to help, and they're willing to just give you that support to get through.
All right. So if people go on Facebook and just punch in Heart and Stroke, these groups should pop up, right?
Yep.
Okay, perfect.
And Renita, I just want to ask you this before I go along to the next caller.
Sure.
You go in, you see a specialist, and you're trying to absorb everything they say. And don't you find you come away with like 25 questions and wish you could have had a follow-up appointment an hour later so you could say, what about this? What about that? What about this?
Yes, I know exactly what you mean.
And, in your case, it could cause, a little bit of worry, like my heartbeat was going up so high. What was going on, right?
Yeah, and especially when you're a mom.
Right. And so there are probably others on this Facebook group who have experienced similar things. And
I love that idea. It is an awesome idea.
Yeah, and what we say is make sure you check with your healthcare provider as often as possible. As Dr. Connor said, if something doesn't feel right, make sure you get checked.
Yeah.
Yes.
Yeah. I'm so glad that you called in. I hope you call again sometime.
Okay, thank you.
Thank you so much. A couple of people stacked up trying to get through with calls, but this is a really important email that's just come through from a listener, and the listener's name is Mike. And I just think this is such a brilliant and absolutely crucial question to ask on the show today of both of you. And it's simply this. Mike wants to know, is it normal to suffer depression after a heart attack? Who wants to jump in here?
Yeah.
All right. Dr. Connors.
Yeah, Mike, absolutely. We see that quite frequently. I mean, I think especially people that prior to the heart attack had been completely well. I mean, you might feel invincible. You've never had any brushes with the healthcare system. And during the throes of treatment for the MI, you don't really have enough time to kind of piece everything together, I think. And the other thing about a heart attack is I think you realize that it is a brush with mortality. 40% of people that have a heart attack they don't make it to hospital. They don't survive. Now, if you make it to hospital, we do a great job, but we think 95% of people or so will do well and get back to work. But it's a big readjustment in your life. And any time you have that phase of readjustment, I think depression is certainly a risk. And those are things that our healthcare providers, our family physicians are very tuned into. But it's normal. And I think that, we see people get through this. I mean, sometimes there's even a component of PTSD following a big healthcare scare.
Sure, it makes sense, right?
Yeah.
Your world got turned upside down, and you probably have some images in your mind of the urgent medical attention, connected to the urgent medical attention you were getting.
And it's only when you get home that you realize it was a brush with something that could have been very serious. And, you're distracted in the hospital, but you're not so distracted when you're home. And your mind has time to work and go through all these things. And maybe the new medications we put you on contribute to some of those things. So I'd encourage you to get the help that you need.
And John Kirby, you wanted to jump in with something there.
Yeah, I think just talking about it too, we need to understand that it's absolutely normal. And through, I know our women's campaign, we've asked people to get loud about heart disease and stroke and make sure that they keep talking about it. They keep making sure it's on the tip of their tongue, because we don't want anyone to suffer or worry alone. That often things like what we talked about, the Facebook group, that you can find strength in numbers.
So just one thought on trying to support someone who's had a heart attack, if it's a friend or a relative of yours, maybe not someone you see every single day, but when you are in touch with them, it can be really helpful to say, how are you doing? Absolutely. Rather than maybe saying, oh, look at you, you look so great, because then they don't have that opportunity to open up and say, well, I'm actually, I'm finding this tough emotionally.
I think we need to make it part of more of our conversation. I think often in Newfoundland we do that. We say, how are you? How you getting on? But just make more serious note of, how are you actually doing? It could save a life.
All right. Thanks so much for that. We've got Alice, who's phoning in from Toronto. Thanks to listening to the program online. Alice, go ahead. Do you have a question about heart health?
Yes, I do. I have a question for Sean.
Yes, Dr. Connors.
I had a heart attack. Sorry?
Yes, go ahead.
I'm sorry. Is that your name, or did I get it wrong?
Yes,
no,
Dr. Sean
perfect.
Connors.
Oh, Sean. Okay, great. So I had a heart attack 2 years ago, and I didn't have any of the 5 risk factors that would cause a heart attack. So,
can I just stop you for 1 second? Can we?
Yeah, sure.
Can we just? Can one of you rhyme off what the 5 risk factors are? This is Dr. Connors here.
So, Alice, we traditionally would think of, there's lots of risk factors, but, we think pound for pound, the most important one would be smoking. And then we'd follow that up with cholesterol, hypertension, diabetes, your blood pressure. That's typically what people would see on a poster, and they're very powerful. There are some that are not modifiable, for example, whether you're male or female, what your family history is, your genetics, and sometimes there are more nebulous things, like the determinants of health that might just be where you live, the food you eat,
you mean
that
like
sort of thing.
Really like junk food?
Yeah, like the social determinants of health. We often say that your postal code might be a very strong determinant of how you're going to do. Your education level, your housing, your diet, that sort of thing. Yeah,
and John, I am going to get back to you, Alice, I promise, because it sounds like you've had a very harrowing experience, and we're so glad you're still here to tell the story. But John, Heart and Stroke, making a point of letting people know that 9 out of 10 Canadians have at least one risk factor for heart disease, right?
And like Dr. Connors was saying, there's more than 5, right? It goes to things like stuff we can't control, like genetics. I know that's a huge conversation in Newfoundland right now. But like you said, smoking, nutrition, physical activity, even water consumption, right? So making sure you're tuning to all the factors, and even if you don't seem to have any of those risk factors, again, if something doesn't feel right, and make sure you're checking with your healthcare professional as often. Yeah.
All right, Alice, back to you.
Yeah, thanks. If you talk about diet and exercise, I previously had a very good diet and exercised for about 15 years. But the question I want to ask you is, What are the odds that someone like me, who is otherwise healthy, having a heart attack? That's one question. Because my family doctor keeps on saying, "Oh, you shouldn't have had a heart attack." It's so I've never had a patient who's had a heart attack and has been otherwise healthy, and so it's kind of frightening to me when she says that to me all the time. So that's one question. And I work out, more seriously now that I've had the heart attack. So I do cardio 4 times a week, so an hour each gym visit, and I do weights as well. Is that enough? And I don't necessarily do it every single day. I kind of spread it out depending on my schedule. So I just wanted to get your sense about that as well.
Yeah, great questions.
Well, Alice, first of all, I'd say it sounds like you're really well informed and you've done a lot of your own background and research. Mm-hmm. Unfortunately, I mean, I hear your frustration, and although your family doctor might tell you that he's never had anyone else who has been, for lack of a better word, as fit as you are, with no risk factors and still have a heart attack, we see this not infrequently. And
we all hear the stories of people who've been running it for years.
Absolutely.
And,
pictures of health.
Yeah.
And they have a heart attack. Largely, it could be genetic. Or, as a woman...
It's not in my family.
No.
It's not in my family. Oh.
Right. So it might not be genetic in your case.
No.
But we know women are different in terms of their physiology and their cardiac anatomy. And we do know that there's a different type of heart attack. I'd kind of need to know about the details of your heart attack to see whether this had affected you. But in women, about 25% of heart attacks are not necessarily from a blockage, but a tear in the artery. So women are different. How are they different?
I had a blockage. I had 2 blockages, one at 90 and one at 70.
Okay. Women have, there's pregnancy, there's menopause, there's different hormones. So the cardiac physiology is a little bit different, which we put a lot of time and effort into trying to sort out over the last few years. But every now and then we have people like you, and as I said, it's not infrequent. They have no apparent risk factors. And, although it's not genetic in your family, you may have been born with a set of genes that put you at risk for developing, I say, rust on your pipes. I mean, that you've developed some blockages, and those blockages got to the point where you had that heart attack. So it sounds like you've recovered very nicely. Now, your second question, I think, is really important as well, and that is, how much exercise is enough? Do you need to run a marathon 3 times a year and train like that? Or can a moderate amount of exercise give you the same health benefit? Well, I'd like to tell the people that are listening that we want you to do 20 or 30 minutes of exercise most days. You don't need to run an hour and a half a day. That gives you the health benefit that we require. And those 20 or 30 minutes, you should do something that makes you sweat. Get your heart rate up. I prefer it not to be kind of a very gentle walk where your heart rate doesn't go up 10 beats per minute, but something that makes you sweat. But more than 30 minutes a day, I think, is great if you want to perform and achieve some goals. But you don't necessarily get more health benefit doing even more.
Oh, I don't, eh?
No.
Oh, that's interesting.
So that's really useful advice. And it sounds like it could save you some time.
Well, that's the thing, because I do an hour 4 times a week, and that is time-consuming. And I thought the more I do, the healthier my heart will be, but you're saying that's not necessarily the case.
Right. I mean, we've looked back at studies thinking that, should marathon runners be healthier than people that go to a local gym and exercise 30 minutes a day or 20 minutes a day? And it turns out that no, they don't have 3 or 4 times the health benefit from doing 3 or 4 times more exercise than what we recommend. So I think everything in moderation, and that applies to exercise as well. So I think you need to couple that with a good diet. I know you're not smoking. You have nothing that in terms of your genetics, your blood pressure. I mean, these are the other variables in that, we call them risk calculators. And I'm sure your family doctor has looked at this. And we can run you through those numbers, and I'm sure he has, and calculate you a percentage likelihood of having a heart attack over the next 10 years. But you've got all your bases covered. You're doing a great job.
Yeah,
how do I get that information? What's it called, a risk coverage?
Yeah, well, you can. There's the one that we use most commonly in Canada is a Framingham risk score. So those classic risk factors we talked about just at the beginning of your call all you can enter in the actual numbers, and it'll spit out a percentage likelihood of you having another heart attack in the next 10 years.
What's it called? I'm sorry, I'm going to write it down.
Framingham. There's
Framingham, all one word?
Yes, all one word. It's named after a city in New England. So Framingham
risk score.
Okay.
Okay, so thanks so much. So you're saying just an hour is not going to make me any healthier every visit? 30 minutes is good enough?
Yes, I think that
20 to 30, you said,
20 to
right?
30, but consistently,
of breaking
most
a sweat.
days. Like I would say 6 days a week. Give you 1 day off.
Yeah, I can't do 6 days a week. So that's why I thought if I do 4 days a week, that makes up for the fact that I can't do 6 or 7. But is that not logical?
I think that's logical. I mean, total exercise time over the week. I'd like to see it more than 4 days.
And actually, John, you've got a kinesiology background. So can I put you on the spot here?
Absolutely.
Obviously, getting to the gym can be tricky to do 6 days a week. Can you think of alternatives that people could try out at home or just outside their homes to break a sweat for 20 or 30 minutes a day?
I think we often, and my background is not only in physical education, but as a former personal trainer, that make it as simple as you will enjoy. I think that's the biggest thing I tell people. Go for a brisk walk. Know that light walking doesn't have that much benefit, but a brisk walk outside, especially all of us that live mostly sedentary lifestyles now, sitting down in offices and whatnot, that getting out into your community at the minimum is going to help you reduce those risk factors. And I would say that's absolutely amazing that Alice, that you can get to the gym 4 days a week and for an hour. I'd encourage you to actually keep it up.
Keep it up?
Yeah, absolutely. I mean, if you enjoy it and it's helping you, I mean, again, make sure you do check with your healthcare provider, but that if you enjoy that, like Dr. Connor said, you can moderate it. It doesn't need to be strictly for an hour. We tell people, often we've told people for years that it's 150 minutes over the course of a week. And actually new research that I discussed this morning, specifically around other chronic diseases, is honing in on that it should be at least 20 to 30 minutes, 3 to 4 times a week, and making sure that people are just generally as active as they can be.
Thank you. Thank you so much, Alice, for calling in.
So much.
I hope that was some help.
Thanks. It sure was.
Yeah, I think it was helpful for all of us. And, don't forget the stairs in your home, right? Especially if you have 2 sets of stairs. You could be like, going up and down your stairs carefully and walking around your rooms, because just going up the stairs puts your heart rate up.
Yeah,
right? So you could walk as much as possible inside your home and do some more stairs.
And everyone's got a chair. I do chair sit up, sit downs. Those help strengthen your legs and help
so you just get up and out of your chair over and over again?
In and out again, yeah. And you'll feel your heart rate go up. You'll feel your muscles start to activate. And just doing, again, something as simple as that can help you not only in enjoy your quality of life more, but make you less prone to these diseases.
And you could be watching a movie while you did that. Okay. Perhaps not the idea here. All right, on with our heart health phone in here. I'm in studio with John Kirby from Heart and Stroke Newfoundland and Labrador, and cardiologist Sean Connors. And we've got Wendy who's calling in from Postville. Thanks for standing by there, Wendy.
Oh, you're welcome.
Yeah, so go ahead. Did you have a question about heart health?
Yes, I was wondering, what is caused from an enlarged heart?
Hi, Wendy.
Is there something that causes an enlarged heart? That's a great question.
Right, Wendy. Where Postville? You're from?
Yes, Postville in
I'm
Labrador.
So here, but yeah.
So I mean, enlarged heart can cover a whole bunch of different things, and basically, that's how the heart responds to when it gets stressed or after you've had a heart attack. Sometimes, if the rest of the heart muscle has to take over for the part that's damaged, it can enlarge itself. But sometimes, so we would see that commonly, but also sometimes people can get an enlarged heart because one of their valves has a problem. And so as the heart tries to struggle with this extra work that it has to do because one of the valves doesn't work right, there's 4 valves in your heart, it can enlarge. And sometimes it can be from a gene you've been born with that caused your heart to enlarge, or a virus that you might have picked up somewhere. Some of the causes of heart enlargement reverse on their own. Some we can reverse with medications.
Okay, well, I got to go to St. Anthony now next week. My appointment is on a Tuesday.
Okay, but it is something that needs to be... I'm glad you're getting a check done.
Oh, my God, yes, Dr. Forrest, and he was trying to get hold of me for a while now to do that.
Okay.
And I finally got hold of me, so I got to go for that. And another thing, when I got the flu shot too a few times, a couple of years, it got me really sick. I couldn't get out of bed.
Really?
You couldn't touch me. I was so sore. Even to lie on the mattress, I was pure sore. Like, you know, anything, and I didn't even know what day it was. Couldn't eat, couldn't hold in water. But after that, I never had a flu shot since 2 years now, and I've never got the flu since.
Well, people that...
Before, the first year I got it, it was good.
Right. And, of course, every year the flu shot is a little bit different.
It's different, yeah.
So I would encourage you to talk to your family doctor when you see him, because people that have had unusual reactions to the flu shot, we are a little bit more cautious with.
Yes, exactly. It was really sick, and that's what I think the cause was that. And when I get the flu, I get really bad, real bad.
Well, that's probably something you could ask about in St. Anthony as well.
Yes, exactly.
Right?
Yes, exactly. And because I had a friend, too, that had an enlarged heart now. He passed away last year in Nain, Labrador, and he went to bed and he never woke up. And that was possible. They said that he had an enlarged heart. Mm-hmm.
Well, it is something that needs to be checked on, and I'm glad to hear that you're going to get it checked on.
Yes, okay, thank you so much.
And Wendy, just before you go, of course, best of luck with your trip to St. Anthony. It's a big trip to go from Postville.
Thank you so much.
But can I just get you just for 1 second to kind of illustrate to people listening in the audience what it's like to live in Postville. You don't have a you don't have a family doctor stationed there.
All the time.
Yes, and probably an excellent.
Probably come in once a month, Dr. Forty, from works in Goose Bay, Happy Valley, Goose Bay. So we get him to come in usually about once a month, and the same with the dentist, same thing. So it's only 200. The population here is probably about 230 at the most. And there's only one grocery store, and mostly everything you get is frozen.
Yeah.
So, you know, it's a very small place.
Yeah,
absolutely. And as Dr. Connors was saying, where you live actually affects your health status. It's very true. There's been studies done not only in Canada but throughout the world that the closer you are to whether it's a grocery store or a fast food establishment often determines.
No fast food here.
Yeah, and that's great. And
lots of country food, right, Wendy?
Yes, exactly.
Lots of.
They had for the Labrador Winter Games. You know what the Labrador Winter Games is?
Yeah.
They were saying that they were the healthiest people, Postville. Yeah, and they had that too.
Lots of wild game and
that's
fish.
What it is.
Listen, one more second, actually, because Dr. Connors would like to say something to you.
Okay, great. Thank you.
No, Wendy, I was going to just tell you and Ramona as well that, you know, heart disease in Newfoundland, you know, sometimes people grow immune to us talking about heart disease, look at your risk factors, lose weight, exercise, and so on.
Yes, exactly.
But, you know, it's really important. And, you know, it's the number one reason. You told me your friend, unfortunately, had passed away in Maine, but it's the number one cause of death in Newfoundland.
Is that right?
It is.
Wow.
And we have the highest rates of heart
rates.
disease in the country, right?
Heart disease in women, for example, kills 5 times more people than breast cancer.
Oh, wow. I did not know that. It's amazing.
And for a man that lives in BC, for example, I mean, I think of BC, all these healthy people out running all the time and so on.
Yes, exactly.
The average lifespan of a man in British Columbia is 81, and in Newfoundland is 77. We lose 4 years of life on average in Newfoundland, largely because of our higher burden of heart disease. So, you know, we get out there as heart doctors and we preach about blood pressure.
Because in my family, my mother's side, the Paddles, they had a lot of breast cancer. My aunt had her breast removed, and Mom had 4 bypasses.
Well, there you go.
Dad got dementia, so now that was a couple of years ago, and he survived a brain tumor.
My goodness.
There was very few that did, but he, you know, they said he'll come out as a vegetable or something, but he never. But he's good. But now he got dementia, and he's all in the home and the rest. You know.
Wow, sorry to hear that. We're going to move along because lots of people waiting to get through here.
But thank you
for
your time.
Yeah,
I
thanks, Wendy.
it.
Yeah, have a good trip to St. Anthony, and all best
so
with those
Bye-bye.
tests. Okay, we have got Michelle up next, phoning in from Sheffield Lake. Thanks for that, Michelle.
Hi.
Hi. So, do you have a question about heart health?
Yes. Good afternoon, Dr. Connors.
Good afternoon.
I have ARVC, a genetic heart condition. I have a defibrillator in,
Oh. So you're one of those people who could be shocked back to life.
Oh, yes.
Wow. Has that happened?
Actually bionic.
Yeah. Like I'm thinking about, this is so cool. I'm sure it's been quite stressful for you. But have you actually had that experience that you've been, it's kicked in and shocked you back to life?
No, I've been very lucky. I'm really strict. I don't smoke. I don't drink. No marijuana. I've changed my eating habits. I moved more or less to the lake, fresh air, and things like that. Now I've developed a few problems. Actually, I need knee replacements, which is going to require a surgery. Now I know this. I don't take any flu. I try to have the shot every year. I don't take any medication for like if I do get the flu because it will speed up my heart rate. So I watch that very strictly. Now, I've been on Tylenol arthritic. I know that I can take Tylenol, but is Tylenol arthritic pills, is it okay with my condition?
Well, Michelle, in general for our heart patients, we do prefer Tylenol over other drugs like the anti-inflammatories, whether it be ibuprofen, Advil, Toradol, these sorts of things, because they interact less with your cardiovascular system. So my answer to you would be, acetaminophen, Tylenol would generally be a safer choice. Now, I don't know all your individual medications there, so on, but I generally advise my patients that I prefer them for arthritic type pain to take Tylenol over anti-inflammatories.
Yeah, because I am one of your patients. I haven't seen you for a while, but I'm one of your patients. Because I am taking Tylenol arthritis like 4 times a day. I have to because of the pain. Now I've got to go in for surgery now. I'm thinking the fall. So that's fine because I won't take anything. I can't exercise because of my knees. So it's kind of limiting me. But I'm just wondering because I really hate to take things that I'm not supposed to because I'm very cautious over my condition.
No, it sounds like you're very health conscious and you do have to take something. I mean, quality of life is important and you have to be able to walk around and be active. And I think the risk of lying in bed doing nothing would far outweigh the risk of you taking Tylenol. I would see no problem with that. And the other thing you may be worried about, of course, if you are somebody with an implanted defibrillator and a heart condition is, can you have surgery safely? And, in general, for patients, our anaesthetists have a great experience with, taking people similar to you and they have successful and safe operations. So if that's on your mind, I mean, it sounds like these knees are going to need to be addressed at some point, and I think it could be done.
Yeah,
because I have the battery that is running low.
Oh.
The problem that was out with the batteries in the one, but mine is still up to 55%. So,
well listen,
we do have a system where we can. One of the nice things about implanted defibrillators and technology, I guess in general, I mean, you hear about millennials and technology and so on. Healthcare, we're affected as well by technology. Unfortunately, for people like you that live a long way away, we are able in many cases to have monitors and have information beamed down, and it allows us to keep a closer eye on people. I don't know if you have that monitor or not, but
I do, yes.
Yeah. So,
I have the monitor.
So, although you might not hear from us every day, we like to be able to, have healthcare happen more often in the community, be patient-centric, to be able to employ technology to cut down travel costs and so on. So it sounds like you've been a beneficiary of that.
Good luck with everything, Michelle. It's been really great speaking with you. She's already bionic, but it sounds like she's going to become even more bionic in the near future. And again, best of luck to her. Very quick but important question here before I go to the next caller. Are you still recommending that people who think that they have any risk factors for heart disease take a baby aspirin every day? Where is the advice on that one
Ramona.
these days? It keeps changing, right?
So yes, I mean, I suppose over the years, I mean, look, people are confused about this, is what I would say.
Yeah.
And in the past, we had recommended if you had some risk factors, start taking baby aspirin. Well, it turns out once you scrutinize that practice in the cold light of day to hard scientific studies, it turns out the benefit is not what we thought it was. In fact, it's kind of neutral. And maybe there's a very small benefit, but it's outweighed by the very small bleeding risk. So unless you've actually had a heart attack or a stroke, almost everybody else, we wouldn't advise routinely taking an aspirin a day.
Okay, so check, go on heartandstroke.ca and look at the risk factors for heart disease if you've been taking baby aspirin daily. And if you don't have any risk factors, then Dr. Connor's suggesting you stop, because I know all kinds of people are taking baby aspirin.
Well, I guess what the Heart and Stroke has said is please check with your family care physician.
Yeah, that makes more sense.
A lot of the research that has come out, and we're publishing and adding to our research website, is that making sure that people take it on a case-by-case basis, that you listen to your healthcare provider, and make sure that it's not a dramatic change, right?
Okay, but people shouldn't be automatically doing this. All right, time for one last call here. We've got Jack phoning in from St. John's. Hi, Jack.
Hi. I have two questions. First one is, if you're waiting in line to have open heart surgery and you've got a 90% blockage, how can you tell how much exercise to do? I know that, an hour, or when you said working up a sweat, I thought, oh dear, is that good for me? So that's the first question. And the second one is the connection between night sweats and the possibility of heart attacks.
Jack, Dr. Connors here. So I think, first of all, if you're waiting for heart surgery, generally the people that we let go home and wait, we think are at lower risk. And certainly having blockages there sounds worrisome. But, we would have kind of not let you go home and wait if we thought that those blockages were something that we needed to address, in an urgent fashion. But my advice to you would be, look, I would just take it easy. I think your exercise regime you should probably put on the back burner until we get your surgery done. And then we have some excellent venues and avenues for you to get back on your feet and get your fitness back again. Cardiac rehab is a wonderful program. I mean, almost every single patient that goes through it thinks it's a fantastic experience. So you'll be on some medications while you wait. Go about your normal daily routine, but I would not, take up the 30 to 60 minutes of exercise a day routinely until your surgery's been sorted out.
Okay, thank you.
What about going for something like a walk?
No problem.
Okay.
Yeah, I mean, I think that walking around, normal activities, sedentary activities, but not formal exercise.
And
what about hiking? Say, if you wanted to go on the East Coast Trail, or is that too much?
Jack, I think if it was me, I'd probably stay a little closer to home and, walk around Kitty Vitty Lake or that sort of thing would be something that I'd do.
And so you mentioned night sweats.
Yes, sometimes I have night sweats and I wake up and it's more the anxiety of, is this connected thing, why am I having sweats? Is this connected to my heart? What's going on? That kind of thing. So it's the nervousness that it brings so I wanted some comments on if there was a connection at all.
Jack, I think you're without knowing the specifics of your case, I mean, night sweats for us are kind of a very general sort of symptom. And sometimes they mean nothing other than some anxiety, or some people are just prone to them. I don't know if these are new for you or not. And sometimes, of course, where you've been starting all these new medications, it can be a reaction to some medications. Mm-hmm. We would look for other things. Are they associated with a change in your weight or a change in your appetite and that sort of thing? But I think if they've occurred recently since your diagnosis and with these new medications that, I talked to your family doctor about it. There's some simple blood tests he might want to check, but I wouldn't be too worried.
Okay. Okay, thank you very much.
Yeah, best of luck with everything. And thanks a lot for calling in. I just want to say quickly, because the computer will soon have us off the air. There was another caller waiting to get on the air. Unfortunately, we couldn't get to him, but also wondering, he's had some heart surgeries already, also wondering about the level of activity that is safe for him. So this seems to be a consistent theme on the show today, and perhaps it's something that we can talk about more in the future. But I want to thank you two so much for coming in. Dr. Sean Connors, cardiologist, and John Kirby with health promotion for heart and stroke in Newfoundland and Labrador. Thank you so much. And Facebook groups, just search for Heart and Stroke, and you'll find those Facebook support groups. Thanks for the great questions, everyone, and best of luck with your health.
For more CBC podcasts, go to cbc.ca/podcasts.